As you pull your elbows back, as you pull your shoulder blades back. Hey, this is Dr. Perry from Stop Chasing Pain, and I'm going to show you one of my favorite breathing exercises. We're going to break it down piece by piece, and that's called spinal breathing or spinal cord breathing. Some of you may have seen this in the world of Qi Gong. That's where I originally saw it. So I want to show you the movements, why, and I'll go over why I like them, a few key things I'd like for you to pay attention to. But also, listen, I want you to type in on the search engine on YouTube and watch other people teach it as well. See their different cues, their different inputs, and kind of mix them together and do what feels good for you. It's important to know that you should keep in mind variation, variability, and variety, the three V's that my friend Joanne Elphinston, who's a physical therapist, call those. And that just means give room for yourself to explore and play, and don't think you're doing anything wrong. Just pay attention to pain. I never say there's a wrong way to breathe. I just say there are different ways to breathe. Okay. So let's relax and let's go into this together. Let's talk about positions. All right. Now, I usually like to have my feet about shoulder width apart, a slight bend in the knees, kind of an athletic stance. Shoes is up to you. I mean, if you can do this bare feet outside on the earth and ground at the same time, that's a double bonus win right there. Okay, that's always a great one to do. So separate legs by shoulder width apart, slight bend in your knee. And what we're going to do is we're going to start with our hands together in front of our face and the elbows kind of together. They don't necessarily have to touch. And I like to start this just by hitting my hands together about 3 to 5 times and building up some nice warm friction in my hands. All right, we're going to break this down piece by piece, and then at the end, we'll put it all together in a couple of repetitions. From here, I want your mouth closed, tip of the tongue, middle of the tongue, back of the tongue, at the roof of the mouth, inhaling in through your nose, okay? When you do that, when you start to inhale, I want you to bring your arms backwards this way into what they call extension. Now, where you place your elbows here is negotiable. What I don't want you to do is come up so high that you're trying to get parallel that your traps end up in your shoulders because you don't have the motion in your shoulder joint here, that you're taking it from your traps and you're going to end up at your ears. Right? I don't want to do that. So just take it to what's comfortable. Right there is good for me. And bring your elbows back. And if I'm in the back here, you can see I'm trying to squeeze my shoulder blades together, which is putting me into an extension pattern, right? Now with the hands, I would like for your hands to be nice and wide and open, but actively trying to spread them out and extending them backwards. So not just resting here and not just like this, but really splaying them out and then opening up into extension like that. That's marvelous for the brain because there's so much of your hand represented on your brain through what's called a brain mapping. As you pull your elbows back, as you pull your shoulder blades back here, inhaling in through your nose. And when you do that, you have to watch the head. I don't want your head to now go forward because you're bringing your shoulders back. Many people will do that because they have such poor motion in the middle of the back that their head naturally lives out here all the time, and they'll pull forward if they can't pull back. That's why I want your tongue to the roof of the mouth, because that's going to center your head and neck more evenly over your torso. Plus, it's going to force you to breathe in through your nose, which is more optimal for moving your diaphragm muscle down below here to get your organs moving. Okay, so we're still in extension, elbows back, arms back, hands splayed, open into extension. I want you to look up towards the sky with cervical spine extension. Now, all of that's going to be happening when you do your inhale through the nose. And I'll talk about like how long your inhale can be. That's negotiable as well. So that's what's happening up top. Now, what's happening down below? From here, when you pull back this way and you bring your head into extension, you're naturally going to start to feel an arch in your lower back here, and you'll extend back in the lumbar spine, and you'll feel your pelvis go into what's called an anterior pelvic tilt. It will tilt forward like this. And that's what I want, because now we're starting to get these spinal motions happening with everything that we're doing. Remember to keep a slight bend in your knee when you do this. So I'm here like this, and I'm arching my lower back as I'm pulling my mid back together, as I'm pulling my arms back, splaying my hand, looking up, and that's going to be the end point of my inhale, right? Now we're going to reverse all of that on our exhale. But when we exhale, you can do it through your nose if you like. I like to exhale through my mouth because I've noticed for me, I can have a much longer exhale through my mouth. I can also make different sounds when I breathe out through my mouth, which is great for your vagus nerve. But longer exhales stimulate your vagus nerve. They stimulate your parasympathetic nervous system to help put you into a relaxed state. So if anything, I just want you to remember, make your exhales longer than your inhales, right? So let's go into the end position of an inhale. Now everything's going to come together, right? From here, you're going to start to bring your head back forward. It's actually going to go into what they call flexion. You'll bring your hands back together into a comfortable thing here with your fingers. Don't go into a fist, just a comfortable thing here. The elbows will start to come together. The hands will start to come together as the head is flexing forward. You're going to really round that back, pulling in. And then down here, what I want you to do is tuck that pelvis underneath, flatten the lower back, tighten this up here, almost like you're trying to do a crunch. So it's this kind of motion. So watch this. Thrusting forward, posterior pelvic tilt now, where you were in an anterior pelvic tilt. You're coming forward, staying bent at the knees. Should have no back pain here. Everything comes together. At the end of your exhale, it should be maximal contraction on everything. So you're basically curling into what they call like a fetal protective position. This is a self-protection position that most people get into when you're trying to protect yourself. For instance, if you're in a fight, something like that. And that's the end of the exhale. Now, when we do the next inhale, everything goes back to what we had before. So I'm going to show you how it all looks coming back together. All right. So remember, this is the second repetition. So this one here is the end of the exhale. I'm going to show you from the side first. I'm going to come up at an inhale. And then I'm going to exhale. So that's a side version. So I'm going to show you from the front now. End of the exhale, coming up. Like that. And I would shoot for anywhere from 5 to 10 repetitions, paying close attention. If you feel like you're getting lightheaded, feel like you're getting dizzy, you should have no pain or discomfort when you do this movement. If you do initially, lighten up the tension, lighten up the force, shorten your range of motion, try to make some changes to it. See if it eases up. It should ease up. If it doesn't ease up, that's a sign that you're not ready for this yet. And then you stop. Okay. This one's going to take a lot of practice, but you'll get it. Don't overthink this stuff. Feel first, think second. And if you stick with this every single day for 30 days, I think you'll notice some really nice positive changes in how you feel in relationship to your level of stress, tension, anxiety, being able to relax, calm down. You may notice a change in your discomfort and pain throughout the body as well. Okay, great job. Now, let's move into me breaking down some of the reasons why I really, really like that move to do it. Now we got the little first slide up, spinal cord breathing benefits of this Qi Gong technique, reasons that I like it. All right, let's break this down kind of piece by piece. So one, you're going to get what's called thoracic spine extension. You're going to get finger extension. You'll get chest opening in the front and cervical spine extension. And you'll also going to get some hip extension at the same time. So let me kind of break those down first, and then we'll go with the anterior fascial line. All right. So one of the things that happens with people because of poor posture and the way we live today is that they're rounded in the thoracic spine, this mid back. They're really tight in this chest anterior region. The arms are pulled in like a monkey, like that, or they're cupped around a phone like this, and the shoulders are hiked up towards the ears, and the head is really far forward or looking down like that. Make sure you check out our video up here on the text neck, some things you can do to help this type of thing. Adding that to this one will be great to do as well. And then you're kind of slumped in this position. And then everything in the front here gets really, really tight, right? This anterior line of connective tissue called fascia and all the muscles in the front part. So the reason that I like this is because when you come up and pull backwards with your chest opening up, your elbows back, your arms are externally rotated, your shoulders are externally rotated, you're pulling back into extension. This is opening up and you're contracting the muscles here that are usually really elongated, tight, and weak. And because people are usually in this flexed position at the fingers all day long because of working on a phone or doing things like this, very rarely do we put our fingers open up into extension like that. And that's really, really powerful neurologically for the brain. And then you're also beginning to use these low back extensors here, because what happens is with this poor posture, when you round in your back, your head goes forward, people tuck up underneath, and this back gets flat, and the erectors of the lower back become long, and they start to atrophy, actually. So when you open up and you dump your pelvis forward and you extend in the back and you pull back here, you're opening all of that stuff up. Okay, I mean, it's absolutely marvelous. Hips also, what's down below, will open up when you pull backwards. Now let's talk about the nose and the exhalation and the pelvic tilt variations and the nervous system, right? Hopefully I'll remember all those. The reason we want the tongue at the roof of the mouth is because that's going to force you to breathe in through your nose. When you do that, you're going to deliver more oxygen to the lower 1/3 of your lungs where you have more blood platelets here. You're going to increase the release of what's called nitric oxide. Nitric oxide only gets released when you breathe in through your nose, not when you breathe in through your mouth. That's going to dilate blood vessels. So it makes blood vessels bigger so they can deliver more blood to something and more blood away from something, like oxygen, and get nutrients to tissue and waste away from tissue. That'll automatically help you get better oxygenation and blood flow to the brain to help you relieve brain fog. Okay, so when you do this pelvic tilt one, when you go into extension like this, you can see you're opening up those hip into extension, you're arching your lower back, you're going to dump your pelvis into an anterior pelvic tilt, and then when you come forward, you're going to go to a posterior pelvis. So it's like a pelvic rock like this, and that's going to teach your nervous system how to find these different zones between an arched back and a flat back. So you should be able to go in and out of those positions comfortably. Problem is, many people get stuck in one range. They get stuck either with an anterior pelvic tilt, which doesn't happen as often as a posterior pelvic tilt, but you need to teach your brain that there's available motion to it, because it forgets that the motion is there because it hasn't been and around that motion for a long period of time. Okay. Now, also too, is that we're so used to being in this closed off, flex forward, fetal fight or flight position that opening up like this is a vulnerability, right? So it's not easy for your nervous system sometimes to open up like that, especially if you've been through a lot of trauma and stress in your life. Because why do you think that you curl forward like this when you're under stress? Because you need to protect all the vital structures that live here. All right. Shoulders go up to protect the arteries and the neck, because if I take you out in the neck, you're dead quick, fast, and in a hurry. Your hands come up in front of your face, your eyes, your mouth, and your throat, because you need those to function in daily life to eat, see, swallow, breathe. So you'll naturally do this, and you'll curl forward because the organs sit right here, and you don't want to take you out in the organs because you'll die pretty fast and it's extremely painful in that region. And you know how you're hardwired to protect this inguinal groin region down below. So everything goes like this. Very few people walk around like this with the shoulders pulled back, arms out, head up, looking straight, confident in the world. I call it tall, lean, mean, and confident. All right. We usually shrivel down like this, especially if we're not feeling well, we have pain, we have social stress, maybe we don't like ourselves or we hate the way that we look. So we curl away from the world and we go into it. So when you do this, you're going to open your body up in different positions, help your sympathetic and parasympathetic nervous system balance, called your autonomic nervous system as well. Teach your nervous system how to find the different ranges of motion, but also teach your body to hopefully not be so scared and vulnerable when you get into these positions. So I want you to see, when you break the body down from doing this spinal breathing, spinal cord breathing exercise, it's about way more than just the breathing itself. And of course, your spinal cord and your spine are moving at the same time, because you have to realize that your spinal cord is going to come down from the brainstem here, and it goes all the way down here, and then it tethers off. But anytime you move your head up and down like this, you are going to actually stretch and relax your whole spinal cord and nerve roots to come off of it. Right? That's why if you've ever had sciatica down your leg and you try to bring your chin to your chest, you feel the pain in your leg get worse. Why? Because you're stretching your spinal cord all the way down when you bend your head forward. Okay. It's the same thing if you slump. So that's why you're mixing all of this head forward, head back, pelvis forward, pelvis back. What do you think that you're doing? You're moving your whole spinal joint, cervical spine, thoracic spine, lumbar spine, but you're also sliding and gliding your spinal cord and helping those nerve roots that are coming off of it going where? To everything else in your whole body. That's why you might feel a whole lot better just from doing this simple breathing exercise. Okay. Thank you so much for tuning in, everybody. I hope you found that valuable. Please make sure you hit that subscribe button and watch all of our other videos, and leave in the comment section below what other type of subjects and things you'd like to see. Also coming very, very soon, we're going to have some courses that you can jump online and take those anytime that you like, if you want to learn a whole lot more about how to feel better, move better, have less pain, and get back to living. Thanks so much for watching. This is Dr. Perry from Stop Chasing Pain. We'll see you soon on the next video. Take care.